All right, hello, I'm James,
And I'm Zach from Physical Therapy.
OT, and then we have Kelly filling in. Our main educating expert is here with us today. We want to go quickly over just a Hoyer transfer, used mostly for individuals that require extensive assist, aren't walking, have a hard time even like rolling in bed, and most importantly with Hoyer, do not do it by yourself. Do not try this at home. But no, don't ever do this one person. Even for experienced therapists, there's too much to manage. So at least pull in two. Sometimes you need more though, depending on how involved the patient is. So the basic setup of the Hoyer here, you have your hooks up top here for your sling. We'll go over that. On this one here, the Invacare 600, it's all electrical, so no mechanical style here. Up and down arrows to bring basically the crane up and down, and then your mechanism to widen the legs or narrow the legs depending on the surface you're going under there. And then widening the legs as well just gives you a little bit more stable surface, so there's no risk for tipping, although that's pretty rare if it's set up right. So last thing was your on button there. You're just going to want to turn that. If the electrical is not working, it's either a battery's dead or you haven't turned this red knob here. So kind of mess around with the buttons first, make sure the battery's working. You don't want this thing to stall out when someone's midair. So before we get the Hoyer over to Kelly, Zach and I are going to show you how to place the sling in bed. So I'll go around this side.
One thing we want to emphasize is really try not to rush the patient. You want to take your time with this transfer because for some patients it can produce a lot of anxiety.
So this sling here, you can usually tell what goes up towards the front by this back strap here, this black horizontal. So this is going to be, the patient's going to be laying on it this way. So we can, really you're just going to choose which side. We have Kelly roll to first. In this case, we'll have her roll to the left so she can help. You can also use the chuck pad itself to help roll. And then the pad itself can also, it can be within the sling. So for now, we can do that. And just tuck it. She's able to roll like very nicely. So in this case, we don't have to really tuck underneath. But what I like to do is kind of cheat to see how that'll fold across her right side of the body, and it looks like that'll be pretty good. And then we'll say, all right, Kelly, you can come back and then give us a roll to this side. And if we need to help, use the chuck pad here. And then we should be able to have her roll back to her back. And you're just gonna check to make sure it's pretty even. It's not, too, like the sling itself isn't too much on the right side, too much on the left. And then make sure like the fabric isn't like way up here on her head or way too low. It looks pretty good right now. And then the next thing is, you wanna bring the Hoyer over? Yes. So another thing is too, you can utilize the bed by bringing it up or down or the head of the bed up, especially if you're doing more of a bed to a chair transfer. You can actually bring the head of the bed up, just say, all right, Kelly, we're gonna bring you up a little bit so it's easier to get these hooks, the loops and hooks in. And then for your backs, just in case, I actually should apologize. I should have brought her up a little bit more when she was rolling. Protect your back if you're using that chuck pad to roll. These loops here, different colors. For the head, you're actually gonna want, especially if you're going to a seated surface, you're gonna wanna be able to get as the lowest loop as possible to have an upright position. So for Kelly, it looks like we can safely get almost all the way down. We can do blue. So this will help her sit up because on the bottom part, there we go. So You got these little safety mechanisms here, won't let the fabric slide out. On the legs to sit, we want it to be a little bit lower. So we'll actually typically do the last loop up top there. So it'd be a little bit tighter up top, loose on the bottom, so it's kind of like a hammock. You're sitting up. And then from here, since Zach's on that side, we can start to lift and head over to the wheelchair.
And just make sure there's nothing in between your path.
Yeah.
It makes it a little bit harder, especially if there's two people. You always want someone, next to the patient, and if they have to run off, then it makes it a little bit less safe.
And give them a heads up too, like, all right, especially if someone's demented, has confusion, we just say, okay, Kelly, we're gonna rise up like an elevator, and we're gonna take you to the chair now. So I like that she's holding her hands in her lap. Sometimes we have folks here that don't have control, so we have them hold on to their affected side inside their lap. Or sometimes it's safe enough to hold the bars there. But okay.
Okay, up we go.
The person not controlling the Hoyer can kind of make sure this fabric is in good position, make sure it's not, and then be asking the patient too, like, is there any pain or any kind of pressure that is uncomfortable to make it to that surface over there? So far, okay, Kelly?
Okay. I'm gonna lower this down. It'll make it a little bit easier for us to do this, so we don't have to raise it up quite as high.
And feel free too to lower the bed rails so you don't have to keep going up super high. And then I would come around here, help Zach steer Kelly to the wheelchair. That's all right. Sometimes that happens, like bend. In this case, we'll go straight on into the wheelchair. It's okay to approach from the side. That way you can recline the chair if needed to have a little extra clearance. And this whole thing rotates, so you can just take the sling itself, start to rotate her legs, and just watch, make sure it doesn't bump into anything there. Really important at the back here, you can either, if the wheelchair has recline option, it's a pretty good idea to recline it a little bit so you can then pull using these straps to bring her as far back as possible. And honestly, even giving yourself a little bit more room than I did is ideal, because when Zach goes to lower her now, just the down arrow there, you almost want to tilt her back in the chair. So she's nice and far back. Good. Watch this bar coming down. Make sure it's not going to bump her. Oh, it's really close, huh? There we go.
Sorry.
There you go. Yeah, sit back, sit back. Some of our Hoyers have a cushion on that. I think we might need to get one for this one. Take your loops off, your blue, oops, and take the black loop off if we have enough. Good. And we can just make sure our feet are in a good spot and back it out. Okay. Anything we're missing?
I think we hit it all.
I think that's pretty much it. Thank you.
Thank you.